Hi everybody, welcome to Unit 3 of Child Development. We're going to start today by just kind of reviewing what happens during conception, and so we're on page 2 of your unit packet if you want to follow along. Alright, so if you'll remember, the sperm is going to travel up the vagina and go through the cervix. At the top of the uterus, the sperm needs to decide whether to take a right or a left fallopian tube. And so the mother's body is going to kind of help by sending little contractions to kind of guide them to the right fallopian tube. And the sperm also have a sense of smell, and so they can kind of decide which fallopian tube to take. Now remember, the sperm can live up to 5 days in the uterus or fallopian tubes, so keep that in mind. Now, once a sperm has penetrated the ovum, conception has occurred, and only one sperm is allowed to get in. Once one sperm enters, there's a chemical reaction and no other sperm can enter. Just one sperm gets in. If more than one ovum is present, they may both be fertilized, and that's fraternal twins. So you can see down here, there's 2 separate embryos that have implanted into the uterus. That's fraternal twins. 2 eggs, 2 sperm. If a fertilized ovum splits, then that's identical twins. And so you can see here, there's going to be one amniotic sac with the 2 identical twins. Now, the fertilized ovum is now called a zygote, right? And it's going to take about a week for it to travel down the fallopian tube and then implant itself in the endometrium lining, where it's going to start to develop. And during that week-long journey, that zygote is going to just keep dividing and dividing and dividing and dividing and dividing and dividing. All right, so there's still a lot going on within that fertilized ovum or the zygote before it implants. Now, it's still going to be a couple of weeks before most mothers figure out they're pregnant, so we're just going to review some of the common signs and symptoms of pregnancy. All right, first, obviously, is the missed period. All right, that's when most women kind of figure out, hey, I might be pregnant, and so they go and take a test. All right, nausea and vomiting. We call this morning sickness, but for some women it lasts all days, or all day long. Sorry. It's more prevalent in the morning when your stomach's empty, and so that's why they call it morning sickness. Tender breasts. If your breasts kind of get tender before your period, when you're pregnant, it's probably going to be even worse because of the hormone changes, and your breasts are changing to be ready to breastfeed, and those changes start immediately. Frequent urination. Even though that zygote is super, super tiny, it is going to start the uterus to start swelling, and so then that puts pressure on the bladder and makes the woman have to urinate more. Fatigue. It's not uncommon to be super, super tired during those first few weeks of pregnancy, to the point where you have to take a nap or several naps throughout the day because your body's getting ready to go through changes and you're just tired. Excessive saliva. Because of the changes to the woman's body, sometimes they produce more saliva, which then makes the vomiting even worse because there's more saliva in their mouth and they gag on it. It's a vicious cycle. Acne. Because of the hormone changes, acne for some women becomes a problem during pregnancy. Sensitive to smells. Things that never bothered the woman before all of a sudden just honestly really, really stink. And it's just kind of a way for the mother to protect herself and that unborn baby from dangerous things. And then last is spotting. Spotting is kind of like noticing blood in your underwear. It's not a heavy flow, it's just a little spot. It happens in 20 to 25% of women, so it's not uncommon. You just need to watch and make sure that that doesn't become a heavy flow, because that indicates a problem. So those are all of the common signs and symptoms. All right, so now we're entering into what we call prenatal development. So prenatal development is the study of the baby before it's born. All of the changes that are happening, all of those kinds of things. It lasts for 40 weeks. Now, typically we say that women are pregnant for 9 months, but it's really closer to 10, right? It's just that most women deliver before that 40th week. So we're going to divide that 40 weeks, which is 10 months, 280 days, and we divide that into 3 trimesters. Now, the baby's going to grow from the size of a pencil dot to a 200 billion cell person. Right? It's going to go from poppy seed to watermelon. And the rate of growth is just outstanding. All right, you can see the changes to the mother here. Month 1 through 3, you're not going to notice that she's pregnant. There might be a tiny little baby bump, but it's mainly just swelling. All right, by about 4, 5, 6 months, you definitely can tell it's pregnancy. All right, until 9 months when it's a watermelon inside there. All right, now if that great rate of growth continued past birth, babies would weigh 160 pounds by their first birthday. Thank heavens that that rate of growth stops. But you can see from that example that it's growing so much during those 40 weeks that it's just an impossible rate to understand the growth. If that rate of growth continued for 18 years, we would all be 135 feet tall and we'd weigh over 2,000 pounds. All right, thank heavens it slows down, right? Because that's just crazy. Now, we divide pregnancy into 3 trimesters, and we kind of have this funny meme that says the first trimester, you're sick and tired, and it's because your body's getting used to the hormone changes and everything, so you're sick and tired. 2, aw, baby kicks. You start to feel better in the second trimester. Your hormones balance out, your body gets used to it, you're excited, you have that pregnancy glow that people talk about, and it's like the easiest trimester. And then by the 3rd trimester, especially the closer you get to 40 weeks, you just want to get this baby out. You're kind of done. So we're going to start by talking about the first trimester and the things that happen to the fetus during that first trimester. So for the mother, the signs and symptoms are recognized. The missed period, the nausea, the vomiting, all of those different things. All right, there's very little, if any, weight gain. Remember that zygote is the size of a poppy seed, so it's not going to cause the mother to gain weight at this point. In fact, she might actually lose weight, especially if she's super sick with morning sickness. Now, for the fetus or the baby, the majority of physical development occurs. So by the end of the first trimester, everything's in place. All of the physical features, the vital organs, the heartbeat and brain waves are there and they're complete. They're just super immature and super tiny, but everything's in place. So because of that, the first trimester is the greatest time of risk and vulnerability for birth defects. And we talked about this in Unit 2, that you have to be careful those first 6 to 8 weeks because that's when everything is forming. So you have to be careful with medication, things in the environment, and lifestyle choices, because things that happen in those first weeks can cause birth defects. So we're going to look at some pictures of how different organs and physical features develop. So we're going to talk about the ear first. So you can see at 10 weeks, the ear kind of looks like a little gill. It's really close to the eye on the side of the embryo's head. And then 4 months, it starts to look like an ear, maybe a cauliflower ear. Those of you who are familiar with wrestling know what cauliflower ear is. And then by 5 months, it takes on a definite shape where you can tell it's an ear. All right, here's arms and hands. So 1 month, it's just a tiny little bud. All right, by 6 weeks, you can start to see the webbed fingers, and there's a shape. This down here is the leg and the foot. It starts to take shape, but it still kind of looks like a flipper. By 10 weeks, we see definite fingers, and you can even see this white part right here is the elbow. For hands and feet, everybody kind of has webbed fingers and toes at first. At 7 weeks, you can see the skin in between there. But by 13 weeks, that webbing should go down, so that you can definitely see finger definition. This down here is a foot. It kind of looks like a hand, but it's going to elongate as the weeks go by and really look like a foot. All right, the second trimester, we're going to see increased organ development. Remember, they're in place. The organs are there. They just need time to develop. Also in the second trimester is when the mother feels the baby move for the first time. And it usually happens around 5 months. And they call that quickening. It feels like bubbles or butterflies and kind of lower down in the abdomen region. And the mother probably felt it for a couple of days and didn't put it together that it was her baby. And then once she does, she was like, oh, that's my baby moving. All right. It doesn't hurt yet because the baby's still pretty small. It just feels like bubbles, butterflies, those kinds of things. Now, the second trimester is physically the easiest on the mom. We kind of talked about that a minute ago. She feels better. All right. The baby's kicking. She's excited. She's starting to show. And so people are excited for her. All right. Then we enter the third trimester. And the third trimester is just about continued organ development, getting those organs ready to work on their own. The fetus is also going to gain a fatty layer. In these last 3 months, it's going to gain about 5 to 6 pounds. So this is when the mother does start to gain weight herself because that baby's getting bigger. The lungs need to develop. The lungs are one of the last things to develop, which is why the longer you can keep that baby in there, the better it is, so that it can breathe on its own once it's born. And then it also builds antibodies. It takes antibodies from the mother and kind of takes them as their own so that they don't get sick immediately once they enter our cold, germy world. A couple other things that happen during the 3rd trimester is the fetus is going to get a waxy substance. Some people say it looks like butter, other people say it looks like cheese, but it's a waxy substance that protects the fetus's skin. Remember, the fetus is in water the whole time, so this is going to stop the fetus from getting all wrinkly or pruny. You know what happens when you're in the bathtub or the hot tub too long, you get all pruny. Vernix stops that from happening to the baby's skin. It's a great moisturizer when the baby's born. They're actually going to rub that in its skin. All right, they'll wipe off as much as they can, and then they'll rub it in. These babies were born with a lot of vernix. Most babies don't have this much. All right, they wipe it off before they take pictures of it. This baby is like covered in vernix. They also get fine hair all over their body. This is another thing that protects their skin while they're in the uterus, and it also helps the vernix stick. So you can look at this baby that was born premature, and he has a lot of that really fine hair. It will eventually fall off, all right? But just know that some babies, especially if they're born premature, they have a lot of lanugo left on. Because in the last 2 to 3 weeks of pregnancy, the vernix and lanugo diminish. And it's just because it's been on there for a while, and it starts to just kind of go away. But if a baby's born premature, you're going to notice more of those 2 things on the baby. The other thing that happens in the 3rd trimester is called lightening, and this happens right before delivery. And that's just where the baby is going to drop into the mother's pelvis. So before lightening occurs, the baby sits pretty high and squishes all of the mom's organs, the lungs, the stomach, all of those kinds of things. All right, once the baby drops or lightening occurs, there's more room and the mother feels like she can take a deep breath. So that's why they call it lightening, because there's more room for her to breathe. So the 3rd trimester is physically the most demanding on the mom due to the fact that she's just uncomfortable at this point. It's not cute anymore. She's just ready to have this baby. Right now, last thing we're going to talk about is the 3 stages of prenatal development. So we have the zygote. Those are the first 2 weeks of pregnancy. So from conception, implantation, and then a week after that. Then we have an embryo. And I always think it looks like a shrimp, like a piece of shrimp that you're ready to eat. But it starts to take shape a little bit. This is week 3 through 8. All right, so you can see this is going to be the eye. You can kind of see the arm. All of this is the heart and the stomach and all of your internal organs right there. And then we have the fetus. This is 8 weeks to 40 weeks. Okay, so here it is. We have zygote, embryo, fetus, baby. Technically, it's not a baby until it's born, but we always just call it a baby the whole 40 weeks, sorry. All right, and then here it is in like what real pictures look like. You can see the zygote is the cells, embryo, it starts to take shape, and then we have the fetus. All right, I'll talk to you guys soon. On your Google Slides, there are 3 videos that kind of go over the changes in each trimester. I'm hoping you can open them. I know your Chromebooks sometimes don't let you access YouTube, so if you can't open them, we'll see them when we go back to school. Have a great day, guys. Talk to you later.